Hello, this is Dr. Bill No from North Texas Hospital, and I'm here to be assisting with ambulation with range of motion exercises. All the following exercises will be on the screen. Make sure you have a written doctor orders and instruction from the appropriate provider to perform range of motion exercises. Assemble towels and or bath blankets for the patient. Lower the bedrail near you if it is up. Then position the patient supine, flat on his or her back. Fanfold the top linens to the foot of the bed. Only expose the body part being exercised. We will begin the first exercise, which is the neck. Exercise the neck only if it's allowed by your facility and/or if you have been instructed to do so. Supports the patient's head and jaw with both hands. The head should begin in a neutral position. And we'll begin with flexion. Bring the head forward unless it's contradicted. The chin should touch the chest. Extensions next. The head's back. Avoid hyperextension. Rotation. Turn head from side to side. Lateral flexation. Move the head to the right, to the left. Now we start with the exercising of the shoulders. Grasp and support the patient's wrist with one hand and the elbow with your other hand. Then we'll begin with flexion. Raise the arm straight out in front of the patient and over the head. Then we'll start with extension. Bring the arm down to the side. Abduction. Move the straight arm away from the side of the body. Adduction. Move the straight arm to the side of the body. Internal rotation. Bending the elbow unless contracted. Place the elbow at the same level as the shoulder. Move the forearm down towards the body. External rotation. Move the forearm towards the head. Exercise the elbow next. Grasp and support the patient's wrist with one hand and the elbow with your other hand. Flexion. Bend the arm so the same size shoulder is touched if possible. Extension. Straightening the arm. Then we'll exercise the forearm. Grasp and support the patient's wrist with one hand and the elbow with the other hand. Pronation. Turn the hand so the palm is facing down. Supination. Turn the hand so the palm is facing up. Then we will exercise the wrist. Hold the wrist with both your hands. Flexion. Bend the hand down. Extension. Strain the hand. Radial flexion. With the hand straight up, turn the hand toward the thumb approximately 20 degrees as the patient's waving. Ulnar flexion. With the hand straight up, turn the hands toward the little finger approximately 30 degrees. Then we'll exercise the thumb. Hold the patient's hand with one hand and grasp the patient's thumb with your other hand. Abduction. Move the thumb out away from the index finger. Adduction. Move the thumbs in towards the index finger. Opposition. Touch each fingertip with the thumb. Flexion. Bending the thumb into the hand. Extension. Move the thumb outside your fingers. Then we'll exercise the finger. Abduction. Spread the fingers and thumb apart. Adduction. Bring the fingers and thumb together. Flexion. Curl the fingers to make a fist. Extension. Open the hands so the fingers and arms are straightened. Then we'll exercise the hip. Support the leg by placing one hand under the patient's leg and your hand under the patient's knee. Flexion. Raise the leg and bend the knee. Extension. Strain the leg. Abduction. Move the leg away from the body. Adduction. Move the legs toward the other leg. Internal rotation. Turn the leg inward. External rotation. Turn the leg outward. Then we'll exercise the patient's knee. Support the knee by placing one hand under the patient's knee and your hand under the patient's ankle. Then we'll proceed with flexion. Bending the knee. Extension. Strain the knee. Then we'll exercise the ankle. Support the foot and ankle by placing one hand under the patient's foot and your hand under the patient's ankle. Dorsal flexion. Pull the foot forward and push down the heel at the same time. Plantar flexation. Turn the foot down or point the toes. Then we'll exercise the foot. Support the foot and ankle by placing one hand under the patient's foot and your hand under the patient's ankle. Pronation. Turn the outside foot up and inside down. Supination. Turn the inside of the foot up and outside down. Then we'll exercise the toe. Flexion. Curl the toes. Extension. Strain the toes. Abduction. Spread the toes apart. Adduction. Pull the toes together. You have just finished the exercises. Cover the patient's leg and raise the bedroll if it is used, and go to the other side and repeat if it is up. Repeat these exercises for the other side of the body from the shoulder down. Make sure the patient is safe and comfortable. Please call light and personal items with easy reach. Wash hands to ensure infection control. Communicate any specific observation, complication, or unusual responses to the appropriate provider. Also record information in his personal chart in the EMR. I hope this video has taught you about range of motion exercises. So long!